Okay, good morning, dear guys. So we continue our set of lectures, and we will continue from the. In last class, we discussed the topic about drug abuse. It was very interesting, and so created a lot of questions during the last lecture, and that's why I couldn't afford to explain the rest of topics later. But now we'll continue with the injury by physical agents. So what are injuries? Which injuries are happen due to physical agents? So, and first of all, we have to classify it. Yes, there we have to explain. We have discussed what is mechanical trauma, thermal injury, electrical injury, and injury produced by ionizing radiation, and is discussed separately. So, first of all, let's talk about mechanical trauma. So mechanical trauma may inflict a variety of forms of damage. The type of injury depends on the shape of the colliding object, the amount of energy discharged and impact, and the tissues or organ that bears the impact. So 1 minute. Also tissues react similarly to mechanical forces, and the patterns of injury can be divided into abrasions, contusions, lacerations, incised wounds, and puncture wounds. So you know all of them. So this mechanical trauma, mechanical trauma, they cause the cell injury, and this reactions and then response to this injuries you already uh, we already heard about it in a topic about cell injury, and the role is followed with inflammatory reactions. Okay, let's talk about this in details. Abrasion. So abrasion is a wound produced by scraping or rubbing the skin surface, which damages the superficial layer. Typical skin abrasions remove only the epidermal layer. So this abrasion is not so severe, and we used to use a lot of smearing drugs, which can help us to heal this abrasion. Of course, severity depends on amount of abrased skin, but anyway, so you know that first task in case of abrasion is to prevent bacteria entering to this tissue. Okay, then contusion. Contusion or bruise is a wound usually produced by a blunt trauma and is characterized by damage to vessel and extravasation of blood into tissues. So here we have a few examples. So this is bruise, typical bruise due to trauma. So small capillaries and veins and arteries, venules and arterioles are damaged, and then blood and penetrates into the tissue, and then erythrocytes undergo the process of erythrocyte degradation, and which is reflected here in bruises. So that's what you already known about it, but we have to discuss it. And then, okay, the next one is laceration. Is a tear or disruptive stretching of tissue caused by application of force by a blunt object. So you see, laceration is very severe. So because edges of trauma are not slight, yeah, and this after the abrasion we need recovery, so very hard recovery. So for example, we need a surgical treatment here, because we need to incise this lacerated parts and and transform the laceration trauma into the incised wound. Incised wound, and that because incised wounds they can repair much faster. It's all about wound healing, yeah. So wound healing happens so much better when tissues are very closely attached to each other, and then in a process of you remember formation of granuloma, formation of granulation tissue. So we need to have a very fine adjustment of tissues nearby. If they're very far from each other, it will come into chronic inflammation and granulomatous inflammation in this area, and of course it's harder to be healed. So incised wound. So you will, as a doctor, especially if you're going to be a surgeon, so you will encounter with this incised wounds. So they are having with a sharp sharp instrument like knife or might be so during the surgery, as I said. And of course, usually incised wounds are straight and very smooth, and that's why they can easily be adjacent to each other with help of suturing and for with the needle. Yeah, we can help to conjoin it together. Okay, puncture wound. Puncture wound. So a puncture wound is typically caused by a long, narrow instrument and a stern penetrating when the instrument pierces the tissue and perforating when it traverses tissue to also create an exit wound. So puncture wound. So you understand? Okay, I'll let Hadi Hussein join. So puncture wound. So typical puncture wound is a needle wound or needle wound. So which is so not usually puncture wound is not dangerous because you see tissues are already very close to each other, and after puncture they keep being close to each other. But we have a little damage, a little danger here, because if needle is not clean, if it contains some bacteria, so we can disseminate we can disseminate the bacteria inside this wound, and it get very well preserved inside. And in case of puncture wound, so which bacteria are most dangerous for us? First of all, it's tetanus, Clostridium tetani. Clostridium tetani. So now, by in microbiology, you will discuss it more. The worst thing of puncture one that it has no approach of oxygen to the area, and all anaerobic bacteria can evolve there much better than in opened wounds. So that's the way. Okay, gunshot wounds are special forms of puncture wounds that demonstrate distinctive features important to the forensic pathologist. So gunshot wounds, so unlike puncture wounds, gunshot wounds, they are made with a gun. Of course, you understand that a bullet, when it penetrates the tissues, it creates not only wound made by bullet itself, but also by vibration which it gives to surrounding tissues, and also by heat which is produced due to penetration there. And that's why around the gunshot you can see the area of necrosis, which also limits the proper healing of this area. And of course, same in surgery, in general surgery, as I will explain to you. And in gunshot, we also have to incise. So we have to convert this gunshot injury into the incised wound. So we have to incise this part of bullet gun, and then conjoin them together. So this way. Okay. One of the most common causes of mechanical injury is a vehicular accident. Injuries typically sustained result from hitting a part of the interior of the vehicle, or being hit by objects that enter the passenger compartment during the crash, such as engine parts, being thrown from the vehicle, or being trapped in a burning vehicle. So it's forensics, so then you can easily. So you already understand what is it, but yeah, we have to a little bit classify them. Pattern of injury relates to whether one or all three of these mechanisms are operative. For example, in a head-on collision, a common pattern of injury sustained by a driver who is not wearing a seat belt includes trauma to the head, chest, and knees. So, okay, you in also it's not a point of my explanation. It's not a point of pathology. So you understand that it's a wound, and how wound is healed. You already heard about. So that's And also don't forget that in some kinds of injuries, so like in contusions, so what is contusion? It's a vibration, so very hard vibration and smashing of some organs in our tissues due to mechanical force. So and you know that sometimes in our body we already have some lesion, we already have some potential injury which might happen there, and due to this. So for example aneurysm of basal artery of brain, aneurysm of so any artery of brain, so and strong injury to the brain, so like as I said, um, so now it will be here, same as I said as contusion. So due to contusion in the brain, so it might cause a rupture of this aneurysm of aorta, and sometimes even this might become life-threatening. And might be heard about these cases, yes, and when in a fight, when two persons fight, and then with the one punch in the face, then some person falls down and died in this case. So it usually happens due to aneurysm of basal artery on the brain, and that can cause yeah, and that even just one hint in the face might cause a death. So that why be very polite, yeah. So don't try to avoid any kind of fights. So because it might be life threatening, because you don't not every of you ever done CT or MRI, so and you can be sure that do you have this lesion or not. Okay, that's not so interesting. So now we'll discuss a much more interesting in pathology, in pathophysiology way. Term is a thermal injury. Thermal injury is an injury which made by increased temperature, and yeah, of course, it's too common thing to say that thermal injury is one type of disease. But in every of this lesion, so it involved the extreme temperatures to the body. So first of all, thermal burns. Thermal burns, so there, so like here on example of United States, burns cause 3.5 thousand deaths per year, 3,500 deaths per year, and results in hospitalization of more than 10 times than many persons. Okay, many victims are children. That's why they always say to use restrict the approach of these children to burning devices, because it can't control properly their actions. So there might happen due to hot liquids, usually caused by hot liquids, and sometimes burns due to opened fire. So now it's this level is decreased because convenient life allows us to restrict children from this hot from this open fire at least, and also we care more about hot liquids now, and that's why burns are not very common right now, but still it's present, and you have to warn about it. Okay. Uh, so the clinical severity of burns depends on the following important variables: depth, percentage of body surface involved, whether internal injuries from the inhalation or of hot and toxic fumes are present, promptness and efficacy of therapy, especially fluid and electrolyte management, and prevention or control of wound infection. So you can say, so burn is burn, yeah, so it's just a lesion. So what's the difference between abrasion and burn, for example? And actually, yeah, it's superficial burns. They act same as in case of abrasion, but there are a few things yeah, which are not, if I'm not mistaken, it's not explained in this book. So during the burn, produced misfolded proteins. Yeah, you remember that burn. So heat can damage the proteins in the cells. Can damage proteins, and these proteins get misfolded. And you remember that with the way our body react on these burns, react on these misfolded proteins, is apoptosis. But when areas with misfolded proteins is too increased, when too many cells are affected there, so it causes not only uh, It causes not only superficial injury, but it also causes acute inflammation in this area, and then the rejection of these organs, burnt organs, are happened. Of course, first of all, we talk about skin. And second idea that this burnt proteins, they can be absorbed by blood and can penetrate into the bloodstream, and they can damage not only adjacent tissues, but also they can damage tissues where these proteins are circulated. For example, it is kidney. So first of all, damage kidneys, and by process of second or third. So usually second type of hypersensitivity reaction. So our body produces the auto-inflammatory antibodies, which form the antigen antibody complexes, and these antigen antibody complexes, they can be stuck in kidneys and cause acute glomerulonephritis in case of sometimes it happens due to burns. So especially due to fire burns. And then next thing you have to worry about is also laceration of tissue. So due to laceration, due to opened surface tissue, so of course we care about bacterial invasion, so that bacteria can easily penetrate through the damaged epithelial layer of skin. Because I study in immunology and inflammation that skin is the first barrier bacteria encounter with before entering into the body, and injury to this skin, so it opens the gates for bacteria, and bacteria easily can penetrate, and they can cause the effects like sepsis, septic shock, and final death. Yeah, and second, and one more thing, which is dangerous in burns when affected a large surface of body. So it is a penetration of proteins to the site of injury. So you know that skin is protective not only from outside to inside, but also from inside to outside. So I mean, if connective tissue is revealed, so during the burn, then plasma can easily penetrate through this. So first of all, it's necessary to wound healing, yeah. But if area is too much, so it leads to loss of a lot of proteins in the bloodstream, and it can cause the an inhibition of albumin and globulins, cause the decreasing of oncotic pressure inside the blood, decreasing of ability of blood to keep water inside, and it can cause edema, generalized edema, which is known as anasarca, and the patient can die on the pike of this anasarca due to lack of water in the blood. So it also can create a shock. It's known as burn shock. So this is burn shock, and of course this and might be, if you heard about these situations, yeah, that they said about this, like, so my relative is in danger. He got a burn, so he requires very costly treatment, with albumin or with blood transplantation. I mean, transfusion, yeah, blood transfusion requires, and plasma transfusion. First of all, plasma transfusion is required in this condition, and please help him. So you just pass your blood for them. Yeah, that's actually happens due to this. Yes.
Sir, actually, sir, we saw many patients that during severe burning, the doctor provide them suddenly, sir, saline solution.
Which solution, please?
Sir, saline solution, sir.
Yes.
So why, sir, they provide the saline solution for due to severe burning conditions, sir?
Okay, saline solution is also, yeah, very very important. Of course, it's also due to the same reason. So this large burns, they cause the evaporation of water from the body. So of course it leaks outside. So if you mentioned that patients with increased burn, so it causes evaporation of tissues, goals, inhibition of suture around. So it also happens. And secondary, we also have to keep the volume of blood. So to prevent this, due to
Yes.
decreased oncotic pressure in the blood, so we also have to keep the level of water in the blood. But also along with it, along with saline solution, we have to keep the level of proteins there, because anyway, if we just inject, if we'll just inject saline solution, it won't keep them alive. So it temporary decision, and that's what I I hope I answered your question. And another thing, yeah, is the detoxification features of saline solutions is also important, because we by injection of saline solutions, because usually patients in this condition cannot drink because of vomiting, because of nausea. We just inject more water, more saline solution to keep just normal blood level to these patients. Not only saline solutions,
Yes.
actually, we also give so in case of injury to mouth, or so also during the, also very common symptom in burns is nausea. So we should inject not only saline solution, but also nutritional solutions with the glucose, with the amino acids, and which keeps them on a proper level of feeding. So it's known as artificial feeding. So it's intravenous feeding. We share them gently.
Yes, and sir, also, sir, the when due to burn, sir, the waterproof layer stratum corneum is lost, so evaporation is increased. In that case, we also need, sir, high amount of water to protect the patient from shock, sir.
Yes. As I said in the beginning, so it's most obvious thing to do. So yeah, first of all, it's vaporizing is the first obvious thing to do. But I explained the other reasons of this. Even in mild burns, so we have to manage the normal circulation of blood, normal water amount in the blood. So it's not common for everyone. So you have to compare your treatment with clinical situations. That's why it's not a treatment of all diseases, a treatment of all types of burns, but it's just supplementary treatment is of course saline solutions.
Yes. Sir,
Yes.
sir, in a severe physical trauma, sir, mostly, sir, the doctor provide the patient, sir, blood from other patient. Sir, if they provide the saline solution, that will not be good at that time.
Why?
Sir, they provide the blood of the other person, sir, but if they injected the saline solution, sir, there is also a fluid, sir, and
Yeah.
so it's not good.
Okay, I guess I understand where you read it. Yeah, so actually now, yeah, in physical injury, so when blood vessels are injured and then blood is lost. So first injury of this, of course, yeah, every blood transfusion is danger. Yeah, it's danger of antigen intake into the blood. That's true, and that's can create autoimmune disorders against the alien blood. That's true, and that's why now protocols are changed. And then in mild injuries, when blood loss is less than 500 milliliters, we don't manage the blood transfusion to these patients. Even if we have more than even we have 1 liter leaking of blood, so also we try to manage more saline solution, 3 times more saline solution, and additional to this, we try to manage colloid solutions. Colloid solutions like dextran-like solutions, and without blood intake. But only if we have severe injury with more than 1.5 liters of blood is lost. Yeah, of course, here we have to manage blood plasma, and also erythrocyte mass. We have to manage to them. But okay, it's a treatment, so let's discuss treatment in a proper topic, in a intensive care unit subject. So then they'll explain it much better than me. But anyway, you at least understand a little bit about this diseases. Okay. Also, yeah, don't forget. So hypovolemic shock is followed with injuries sometimes, as we discussed right now with Amjad. Yeah, and protein from the blood is lost into interstitial tissue, generalized edema, including pulmonary edema, may become severe. So also we discussed it. Yeah, this is anasarca, which we discussed in topic of edema. But also don't forget about inhalation injury. So if burn happens in a flame, so when a person spends some time in a house with a flame, he can inhale a lot of things. So not only fire itself, but also some toxicants like carbon monoxide, also like carbon, just pure carbon inhaled in these patients, and that's inhalation injury. Also should be prevented. And lipid soluble gases like nitrous oxide and products of burning plastics are more likely to reach deeper airways, producing pneumonitis. So that's in these patients it will be look like pneumonia, but actually it's not pneumonia, it's pneumonitis. It's acute reaction to foreign substances in the lungs. Okay. And also system organ failure, organ system failure. So this is usually happens due to sepsis, contamination of bacteria to this area of injured skin, and this it's ideal for, so as shown here, the burn site is ideal for the growth of microorganisms, and of course if it's ideal for microorganism life, it can penetrate deeper in deeper tissues and penetrate into blood, and it causes sepsis. And then pneumonia or septic shock accompanied by renal failure or the acute respiratory distress syndrome, so which is discussed in chapter number 13, respiratory tract, in the next year, are the most common serious sequelae. Okay. That's all we can say about burns. Of course, it's a much more deep topic, and we have a side of medicine which is known as combustiology. So which where we can treat the persons with a heat injury. There we have much better approach, much better explanation how to treat this. But causes of it you have to remember. So it's just cell injury due to, and first of all you have to remember that its injury happened due to protein misfolding. So happening of protein coagulation happens, protein denaturation happens, and this denatured proteins, they also can cause death. And yeah, also one more point: denaturated proteins, they have much more properties for much more osmotic properties. They are much more colloid osmotic. They have much higher colloid osmotic pressure, and due to this, in the case of inside of burns, it causes penetration of blood components, plasma components to the area of the burn. That also makes it severe the loss of water and salts from the blood. So, and this we already discussed with Amjad. Yeah. So even without, so it penetrates even without this osmotic pressure, but osmotic pressure makes it much severe. Okay, and next injury which made by heat is hyperthermia. Hyperthermia, when an entire body possesses extreme pressure. So, and you remember we already discussed about, you have discussed it in physiology. We have a process of homeostasis. Yeah, homeostasis, it's a maintenance of normal temperature, normal acid-base balance, normal saline solution, osmotic pressure. And when this process is injured, so of course it leads to diseases. Okay, and first example is the heat cramps. So heat cramps result from loss of electrolytes through sweating. Cramping of voluntary muscles, usually in association with vigorous exercise, is a hallmark sign. Heat dissipating mechanisms are able to maintain normal core body temperature. Heat cramps happen, yeah, of course, in when sometimes it happens in when you rest on beach. Yes, on this in this beach, when you see when temperature is increased, so when when you absorb the heat from the sunlight, so it leads to formation of more sweat, but this and it leads to loss of electrolytes, and of course this loss of electrolytes can cause a cramp. Okay, then heat exhaustion. Yes.
Sir, Sir, if someone have no sweating and only they have heat lasting through evaporation, then they will have no heat cramp because, sir, electrolyte is not
Yeah,
lasting.
and that's actually that's the next point of our discussion: the heat exhaustion. So, what is the heat exhaustion? So that's it's also a hyperthermic syndrome when normal. So it's very related to heat cramps. It's the most common hyperthermic syndrome. So it causes are similar, but it's much severe case. Onset is sudden, and you see. It causes hypovolemia because of what? Because of failure of regulation of circulation. Failure, so blood vessels are get dilated. So even without sweat, so blood vessels are dilated, and it can cause a collapse. It can cause collapse, and also sometimes it causes it's usually brief, yeah, and then body can rehydrate again. So even without sweat, so it might happen. But sweating is usually it still happens because it's normal mechanism for our body. But even without sweating, so especially without sweating, when we have no vaporizing and loss of energy from the body, heat exhaustion is more common. Okay, heat stroke. A heat stroke is associated with the high ambient temperatures and high humidity. So you see what happens in heat stroke. The temperature is already high, but humidity is also high, and that's why we can't control our body temperature with evaporizing of our sweat. So clinical settings are rectal temperature 106 Fahrenheit. So it's 38 degrees of Celsius, if I'm not mistaken. It's considered a grave prognostic sign. The mortality rate for such patients exceeds 50 degrees of 50%. Okay. It causes peripheral vasodilation, as I said before, peripheral pooling of blood, and decreased effective circulation blood volume, as I said before. Necrosis of the muscles and myocardium may occur, so because of overheat, so an increased heat production, it causes impairment of enzyme work, and also can cause arrhythmias, disseminated intravascular coagulation, and other systemic effects are common. So as I said, as we discussed, you remember what's arrhythmia. So it's an impairment of normal conductive system of heart activity. So and the excitability of the conductive system is increased, and it can cause, and what most dangerous condition here is, of course, the fibrillation, heart fibrillation. And disseminated intravascular coagulation, it causes so heat causes the activation, sudden activation of cascade of secondary clotting factor, secondary hemostatic actions, and then loss of this hemostatic components in the blood, so cause the disseminated intravascular coagulation. We discussed what is disseminated intravascular coagulation, so then I refer you to this topic. Um, Elderly people, persons with cardiovascular disease, and otherwise healthy people undergoing physical stress, such as young athletes and military recruits, are prime candidates for heat stroke. Of course, first of all, if heart failure is happened in patients, heart failure is there. So of course, loss of regulation of bloodstream increase the severity of this heart failure, and they can cause death. And also, you see young recruits and athletes. So they military recruits and young athletes. They you know that. So whoever had been in sport or in military, in army, yeah. So you know that they must you to do some excessive stress, excessive activity, so which can overheat you, and that also can cause this disease. And then malignant hyperthermia. Malignant hyperthermia is not related to external temperature. It happens due to internal temperature increase. High temperature, which happens due to so might happen due to infection inside the body, so which we discussed, it's a fever, yeah. And also malignant hyperthermia might be related to genes. So for example, one example is RYR1 gene, so that control calcium levels in skeletal muscle cells. They yeah, so okay, in affected individuals, exposure to certain anesthetic during surgery may trigger a rapid rise in calcium levels in skeletal muscle, which in turn leads to muscle rigidity and increased heat production. So you remember that calcium release into the sarcoplasm, so leads to contraction of all muscles, and that's a contraction of muscles and shivering of muscles. It causes a heat formation, yeah. But here shivering is present all over the body, and of course more ATP are produced and more reactions of mitochondria are produced, and in mitochondria produces, and of course it leads to hyperthermia in these patients. Um, so this mortality rate of is 80% if untreated, but if we treat it with muscle relaxants, so if we figure out so that this temperature is produced, malignant temperature is produced by muscle contraction, so we can give myorelaxants, and then temperature is decreased. So of course, muscle relaxants are so administration of mild relaxants should be followed with the artificial air ventilation of this patient, because the diaphragm doesn't work also in this condition. Okay, that's a heat affection of the body. So now let's talk about hypothermia. Hypothermia. So what we so in your country it's not very common. So you can say that there are no hypothermia in warm countries, but it's fake. Actually, temperature might increase. Temperature, even temperature with less than 10 degrees of Celsius, it can cause a malignant hypothermia, which causes death. So of course, first of all, hypothermia affects workers who work in very cold conditions. So in Arctic or Antarctica, yeah, or might be in so in Russia, it's very common in Russia in who work in northern states, yeah, in northern cities. They work there outside, and when they don't wear proper amount of wearings, they can die because of hypothermia. And but more commonly, hypothermia is a common cause of death of homeless person, and it so what but what happens due to this hypothermia? Same as hyperthermia, fails the normal activity of enzymes, and this enzyme if enzyme activity is decreased, of course it causes a failure of enzyme activity. Of course it causes a fail in normal metabolic activities of the body, which causes a lot of different changes. So let's talk about these changes. So of course a decrease in temperature causes bradycardia, so which causes a decrease of it also causes acute heart failure. So due to decrease heart beating rate of heartbeats, so less blood can pass to rest of the body, and atrial fibrillation happens. So also it's impairment of normal conductive system of heart activity, and so that's it. So chilling or freezing of cells and tissues causes injury by two mechanisms. So direct effect. So let's talk about direct effect. Direct effect probably are mediated by physical disruptions within cells and high salt concentration incident to the crystallization of intra and extracellular water. So in easy words, when blood is frozen, so you know that there are created crystals, and these crystals possess very sharp edges, and these sharp edges can rupture our cell membranes. And in the skin we have a lesion, so cold lesion. So it's freeze lesions, and they're acting same as burns, and they have to be treated on the same way as burns, as we discussed before. So it's freezing, and we have indirect effects. It's a result of circulatory changes which vary depending on the rate and the duration of the temperature drop. Slowly developing prolonged chilling may induce vasoconstriction and increase permeability, leading to edema. Such changes are typical of trench foot. This condition developed in soldiers who spend long periods of time in waterlogged trenches. So they say it's here shown First World War, but actually it happens in Second World War and in every war where soldiers have to spend their time in cold trenches. Um, Alternatively, with the sudden sharp drops in temperature, the vasoconstriction and increased viscosity of the blood in the local area may cause ischemic injury and degenerative changes in peripheral nerves. In this situation, the vascular injury and increased permeability with exudation only become evident with rewarming. So when rewarming doesn't happen, so they can still be alive. That's why when you warm your patient who has who are that they're affected by cold, so please be very careful. And check his body parts. So that might be it requires surgery. Yes.
Sir, sir, if those soldiers use vasodilators, that will not helpful for
It will
when they
cause
have
direct
vasoconstriction.
later. It would cause the direct effect of cold. So it was an indirect effect, yeah, but it temporarily increase the lifespan of this person, but actually lifespan of the leg, yeah. But anyway, so it's not an effect. Actually, for this case, if you asked about it, so in Russian soldiers they used alcohol for this reason, because alcohol temporarily increases increase vasodilation and actually increase the circulation of blood in peripheral areas. But it has a side effect that during the vasodilation, so it gives a much harder heat loss of the patient and generalized effects. So
Yes,
instead of localized effects to the leg, they get generalized effects of the body cold, and due to freezing of entire body happens. So after vasodilation, so that's why it's not a good option. So yeah, might be temporarily it happens, temporarily it helps, but not for long term effect. And also another injury, so it's here, it's in this book it's not shown, but I don't want you to forget that during the cold, so in chronic cold, so when chronic hypothermia happens, so it leads to increased amounts of absorption from stomach and the rest of the digestive tract. So because if we have enough calories, if you eat a lot of food, so fatty food, or might be with glucose inside, so it can cause it can produce enough heat for you, so, and you can sustain your life. So that's why most of person who found dead in frozen, yeah, so with hypothermia, they have empty stomachs. So this symptom is so evidential to cold that their stomach are very empty, shrinked, and it also has a lot of effects of something like gastritis, inflammation of stomach, because stomach produce a lot of enzymes to digest something in stomach, and it produces a lot of appetite to this people. But anyway, so they have nothing to eat, and that's why they died much faster. So, but if you have something to eat, if you have some source of energy, so then death occurs much later than with the food. Okay, even if you're in open place without heat. Okay, finally, let's talk about electrical injury. Electrical injury. So, and effects of electrical injury so might be subdivided into two types. There are burns and ventricular fibrillation. Ventricular fibrillation. So let's talk about burns. So electrical injury. So we have a effect. So in physics, so you learned physics in last year, and you remember that burns. So what is the process known as impedance? Impedance, yeah, that impedance it's a heat which heat which is produced due to electricity affection of our body parts. So due to this, this heat appears not only in superficial layer but also appears inside in the deeper sides of our body, along with the ray of this electricity impulse. So in this best example of these burns which happened in a body, so due to electricity, is of course it's how it's called. 1 minute. It's a injury more made by lightning. Yeah, so when lightning injures the body, and here we have hallmarks of this entrance of lightning and entrance and exit of this lining. We have hallmarks, but along with this line, we can see some necrosis from in entire the body through entire the body. So everywhere it's encountered with the tissues and increase the heat inside. So actually approach to treatment is a similar in case of burns, like in the usual burns, thermal burns. With some specific work, but pretty same approach. But another injury which is not typical for burns, it's a ventricular fibrillation or cardiac and respiratory center failure. So you see, it depends on the way of lightning pass. Not lightning, might be just usual electricity passing. So it might pass perpendicular to the heart, and it causes disruption in normal current of electricity in the heart, and then it might cause, of course, interruption of heart beating and cause a heart fibrillation. And this ventricular fibrillation causes acute heart failure and cause death. And also, if so electricity passes through the brain stem, it might interrupt the respiratory center, which might cause the interruption of breathing in these patients. So let's talk about voltage. So normal voltage in workplace, it's 120 in USA and Western Europe. In countries like our country, in Kyrgyzstan and last Soviet Union countries, and if I'm not mistaken, in Pakistan and India, it's also 220 volts. Yeah, this is voltage of electricity, so it creates it's high enough that with low resistance to the site of contact, sufficient current can pass through the body to cause serious injury, including ventricular fibrillation. So that's electricity we have approach to, all of you have approach to, so they can possibly be dangerous and they can cause a death. And you heard about these situations a lot, and of course it happens first of all due to wet contact of this. So when water approaches to this electrolyte, water with dissolved electrolytes is approached to the electricity, which is a very good conduction, gives a good conduction to this and cause injury to the body. Okay, that's enough to talk about electric injury. So then let's talk about injury produced by ionizing radiation. Ionizing radiation. So what is ionizing radiation? So that's radiation. What we used to think about radiation, it's usually ionizing. So what is it? Radiation is energy that travels in the form of waves of high-speed particles. It has a wide range of energies that spans the electromagnetic spectrum. It can be divided into non-ionizing and ionizing radiation. The energy of non-ionizing radiation, such as ultraviolet and infrared light, microwaves and sound waves, can move atoms in the molecule or cause them to vibrate, but is not sufficient to displace electron from atoms. So these injuries are injuries made by this non-ionizing radiation. They can cause maximum something related to burns, something like a burns due to active movement of molecules. It might cause also Same, absolutely same effects as burns. So also same misfolded proteins are produced, or maybe physical injury happens inside it. So by infrared light, so which is actually heat here, so it can cause the burns. But much more interesting for us is ionizing radiation. Ionizing radiation, so usually. It has sufficient energy to remove tightly bound electrons. So you remember the chemistry and structure of the atom, structure of the atom, and you remember that if we just imagine this atom with in the center we have protons, around we have electrons, and if we get we start to collide it with the electrons passing over to this, so like gamma rays. So it can ionize it, so it can repel the electron from the surface, or opposite to this, it can adjust electron to the surface, and of course it causes damage to normal connection between atoms and molecules. And of course it also causes same as I said before, denaturation of proteins, but in very different ways. Okay, so which examples we have? X-rays. Yeah, so you know that X-ray is a very common procedure. So we do every year to check our lungs for possession of TB, some TB lesions, or might be pneumonia. So nowadays it's very common in the way of CT. Yeah, in computer tomography we also use the same X-rays, and especially in coronavirus we check lungs for lesions, so which caused by viral infection. And also we have gamma rays. Gamma rays is so essentially, in the easy words we can say that gamma rays are just typical gamma rays, which are more intensive X-rays, as they cause electromagnetic waves, so which cause this the same lesion. And also another much more interesting, I guess, so which is more related to pollution, so more related to pollution of our radiational pollution of our environment. It is alpha particles and beta particles, which are produced by decomposition of radionuclides. So alpha particles, they are composed of neutrons, and two protons and two neutrons, and also neutrons itself, yeah, so then neutrons itself, and beta particles, which are electrons. And you see all of them can, by the same way, they cause the ionization of this some elements in our body, and this ionization, it causes damaging of chemical structure of in very deep parts of our body. So let's talk about this. So, you see, radiologic imaging tests roughly doubled between the early 80s and 2006. So when we measured it, so doubled usually because of CT scan, because they invented the CT scan, and we perform some, and the doctors like to observe it much better. So with the CT scan, yeah, instead of just a flat. Flat X-ray, just an image, X-ray image. So that's why because of the CT scan, amount of radiation is increased, and one person who affected CT scan, so it gained a lot of radiation, but it's still, this radiation is not sufficient to damage person, but if it happens a lot of times, so of course it can causes ionization. So radiation, and we have a fork, yeah, so two-edged sword, so it's shown here, two-edged sword, so I can explain better. Two-edged sword, so in one hand we have this better diagnostic due to radiation. And also we use a gamma knife, yeah, to treat patients with the tumors in a deepness. But in other hand, we have increased radiation, which also mutagenic and carcinogenic, and sometimes even teratogenic to the patients. So you know what's mutagenic, carcinogenic. You understand it from the topic of oncology when we discuss the neoplasia. But what is teratogenic? It's a damage which happens during the formation of embryo. And in case of in case we have X-ray, give X-ray to the pregnant women. So of course, this radiation might cause a little bit a disruption of normal embryo development. So, and let's talk about terms. So we to express exposure, absorption, and dose of ionizing radiation. Curie. Curie is mostly used by physicists. That's directly represent the disintegrations per second of a spontaneously disintegrating radionuclide, radioisotopes. Yeah. So one Curie is equal to 3.7 in 10 in power of 10. So here it's in power of 10, 10 in power of 10, not 1010. Yeah, in 10 in power of 10 disintegrations per seconds. That's a measure, C measure. Gray. So gray is sometimes much commonly used in medicine. Is a unit that expresses the energy absorbed by a target tissue. So, for example, we can measure how much energy is absorbed by lungs during the usual chest X-ray. It corresponds to the absorption of 10 in power 4 ergs per gram of tissue. Centigrade, which is the absorption of 10 ergs per gram of tissue, is equivalent to the exposure of tissue to the 100 rats radiation absorbed dose. The centigrade nomenclature has now replaced the rat in medical parlance. And now let's talk about sieverts. Sieverts is the most commonly used in medicine. Is a unit of equivalent dose that depends on the biologic rather than the physical effects of radiation. So it replaced a unit called the rem. For the same absorbed dose, various types of radiation differed in the extent of damage they produce. So it has a lot of correlation with Gray and Sievert. So now, but Sievert is more related to biological tissue. So in this, the effective dose of X-rays, computed tomography, and other imaging and nuclear medicine procedures are commonly expressed in millisieverts. So millisieverts, you see, it's very low level of damage. And for X radiation, y millisieverts equal to 1 milligray. Okay, now we understand. So what is the injury produced by ionizing radiation? We can what is the reason? So why can we say that this injury is safety, this injury is not safety? Because of what? Actually, because of our opportunity for repair. Yeah. So if our ionizing radiation injure our tissues, you know that if proteins are injured, we can repair them by process of autophagy. You remember that process of autophagy when some proteins are some organelles are injured. We have a very good mechanism by which we can destroy our injured tissues, injured organelles. And also we have a process of proteasomal degradation. So when misfolded proteins also can be degraded. But if level of this injury is too high, so this level of misfolded proteins collected in a tissue, or level of genetic lesions which happened in a tissue, is so high that it causes the activation of apoptotic process in tissues. And of course, apoptotic process it in a massive, so it shouldn't be massive. And if it's massive, so of course it causes not apoptosis, but also it causes necrotic-like features. So with all effects of necrotic tissue. Okay, of course in radiation. So main determinants of the biologic effects of ionizing radiation. So in clinic, you'll discuss this radiations, how to treat it. So let's talk about this. Rate of delivery. Rate of delivery, it's significant modifies the biologic effects. Also, the effect of radiant energy is cumulative. Delivering divided doses may allow cells to repair some of the damage in the intervals. Thus, fractional doses of radiant energy have a cumulative effect only to the extent the repair during the intervals is incomplete. So that's what I said before. So if we have time to repair, if misfolded proteins are degraded, if gene mutations are handled with p53 gene, yeah, and or apoptosis happens not in massive way, then we have time to repair these cells. So then this then it's not dangerous. We can claim it is not dangerous. But if we have no time, so if injury is collected and we didn't handle the previous injury, but we have one more injury, so that's cause a cumulative effect. And we use this effect in radiotherapy. So in also very just before we discussed about tumors, cancers, then radiotherapy is aligned for degradation of some cells, so causing the denaturation of proteins in cancer cells and promoting their apoptotic process. And it depresses the capability of tumor cells to repair themselves, and but in normal cells, when we do the radiotherapy, we just care about a normal tissue which present around, and we count the level of injury which is collected by normal cells. Okay, then field size. The size of the field exposed to radiation has a great influence on its consequences. The body can sustain relatively high doses of radiation when they are delivered to small, carefully shielded fields, whereas smaller doses delivered to larger fields may be lethal. Then, cell proliferation. Ionizing radiation damages DNA, and then cells which are rapidly dividing cells, they're damaged first. Except the extremely high doses that impair DNA transcription, DNA damage is compatible with survival in non-dividing cells such as neurons and muscle cells. As I said before, so DNA damage causes activation of upregulation of p53, which is guardian of genome. p53 in turn upregulates the expression of genes that initially leads to cell cycle arrest, and if the DNA damage is too great to repair genes that cause cell death through apoptosis. So as I said you right before, that's why I don't need to repeat it actually. Hypoxia. Hypoxia, the production of reactive oxygen species by the radiolysis of water, is the most important mechanism of DNA damage by ionizing radiation. Tissue hypoxia, such as may exist in the center of rapidly growing, poorly vascularized tumors, may thus reduce the extent of damage and the effectiveness of radiotherapy directed against tumors. And then vascular damage. Vascular damage. Damage to endothelial cells, which are moderately sensitive to radiation, may cause narrowing or occlusion of blood vessels, leading to impaired healing, fibrosis, and chronic ischemic atrophy. And also don't forget that injury to endothelium causes the formation of clots, thrombi, and then also can even improve this ischemic injury to these tissues. These changes may appear months or years after exposure. Despite the low sensitivity of brain cells to radiation, vascular damage after irradiation can lead to late manifestation of radiation injury in this tissue. So here are the best examples we can say in might be heard as Chernobyl. Yeah, Chernobyl. It's a atomic station in Ukraine. In 1989, it was a explosion in this station, in this atomic station there. So a lot of persons who were affected there, so they are suffering until today time. Most of them are dead already, so all the liquidators, so who liquidate the explosion, so they most of them are dead now. And first of all, they had disease, so directly related to have effects directly related to radiation, or might be related to further carcinogenic effects. So they had a lot of cancers and DNA damage and carcinogenesis. So as a here we shouldn't stop, because in carcinogenesis we explained it in very deep details in practical classes. Yeah, that carcinogenesis is happened, so due to damage of DNA, and as more DNA damage we have, there's more is more frequency of cancer formation in these persons we have, and which genes are up down regulated there, so we can uh, you can imagine. So here, ionizing radiation can cause an indirect effect or direct effect to DNA damage. It's cause a failed or aberrant repair, but if in low dose of ionizing radiation, DNA repair and tissue reconstitution happens. But in failed aberrant repair, so it causes inhibition of cell division and cell death. Inhibition of cell division goes with the help of p53 gene, p53 regulator, and but failed or aberrant repair, so might cause the fetus or germ cells. It's in case of pregnant women, cause teratogenic effects. But in failed or aberrant repair, so of non-pregnant person, it's with additional transforming events, so it causes carcinogenesis. So we always have some additional transforming events, but together with the ionizing radiation, it's increase the rate of carcinogenesis and cancer formation. Fibrosis. So fibrosis is normally so a common consequence of cancer radiotherapy is the development of fibrosis in the irradiated field. As I said before, that due to injury of tissues, it leads to activation of macrophages, which promotes the first of all promotes the normal, I mean, classical pathway of macrophage activation. But when injury is over, so when tissues are repaired, so when offending agent is repaired, in this case it's necrotized tissues are repaired, so are digested, so it causes activation of alternative pathway of macrophage activation. And in this alternative pathway, so of course formation of granulation tissue goes, and along with granulation tissue formation, it causes the formation of scar tissue, and it's known as fibrosis. So what is the morphology? So cell survival and radiant energy damage show a wide range of structural changes in chromosomes, including deletions, breaks, translocations, fragmentation. It causes nuclear swelling, and it causes apoptosis by mechanism we discussed before. It increases cytoplasmic changes due to protein misfolding. Histologic, so plasma membrane breaks and focal defects may appear. Histologic constellation of cellular polymorphism, giant cell formation. Changes in nuclei and mitotic figures create a more than passing similarity between radiation-injured cells and cancer cells, a problem that plagues the pathologists when evaluation post-radiational tissues for persistence of a recurrence of cancer. Okay, here we have target tissues of our body, brain. In adult, it's resistant for ionizing radiation, but embryonic, it causes destruction of neurons and glial cells weeks to months. But I don't think that brain is safe due to ionizing radiation, because in brain we have a lot of blood vessels, and blood vessel injury can cause infarctions in brain too. Skin. How skin is affected by this is erythema and edema happens due to misfolded proteins. So in early period, then it causes dyspigmentation, which happens after weeks or 2 months, so due to failed metabolism in skin tissue. And finally, it causes atrophy, sometimes cancer, so also due to massive apoptosis happened in this tissue. Lungs. In lungs, due to injury, it has edema, so normal effect, so normal inflammatory edema effect, acute respiratory distress syndrome, so also we'll discuss it in respiratory system, and interstitial fibrosis. So the same mechanism, yes, so same alternatively activized macrophages after lesion, so they can cause the fibrotic changes in tissue. Lymph nodes. In lymph nodes it causes acute tissue loss and atrophy and fibrosis, which happens later. So it happens due to injury to other tissues, interstitial injury to other tissues, and interstitial fluid comes into the lymph nodes and continues the lesion in lymph nodes there. And similarly, it causes atrophy and fibrosis, of course. Gastrointestinal tract, it causes mucosal injury in early period, so because there are fastly dividing cells of mucosa, so they lost their ability for division. Then ulceration also happens due to loss of the cells, due to necrosis of the cells, and also cause fibrosis of wall due to same activities of macrophage, alternative pathway of macrophage activation happens there. Then in gonads, yeah, so usually people who go to X-rays, they try to preserve the gonads, yeah, so in males especially. So then, and actually it's true because there we have very fastly dividing cells like mm, spermatogonia, yeah, so they produce their uh, and then you see all the in early period, so it's called the testis, interstitial destruction of testis, destruction of spermatogonia, spermatids, sperm, so which are lineages of the same cell. In ovaries it also causes destruction of germ cells and granulosa cells, which also later impairs the normal fertilization. And of course, as you used to hear, yeah, that atrophy and fibrosis of gonads happened late due to macrophage activation, automatic macrophage activation. And of course, also you heard about blood and bone marrow damage. So blood and bone marrow damage so cause thrombocytopenia, granulocytopenia, anemia, lymphopenia. So it's depression of divisions, so which happens due to same reason, due to same activation of p53 gene, and they're fastly dividing cells, and that cause the spreading of these diseases of bone marrow. Okay, and here it's not shown, but so don't forget about hair. Yeah, hair is also very fast dividing cells, and this hair loss is a very common sign of injury or due to radiation, ionizing radiation. So organ systems, how they affected. So that's enough. And now for the next class remain nutritional diseases. Tomorrow we have a class and we'll discuss nutritional diseases in very deep details. So be ready for this. Thank you for attention. So now I'll check your attendance. 56 students only remained. So here attendance. Okay, who is attendant right now? So we checked it out. Who is left? So then they're left. So and also we'll compare your attendance here with the chat results. So because I don't appreciate when you just join, write your name in the chat and then left. Okay. Okay, thank you. See you next time. Goodbye.